Today I'm going to talk about one of the recent advances in the management of erectile dysfunction. That is low-intensity shockwave therapy. The concept has come from the cardiac people. They have used it for opening up the blood vessels of the heart. And now we know that the blood vessels of the heart are similar to the blood vessels of the penis. Except that the heart, the caliber is 3 mm and with penile vessels it is 1 mm. That is, the penile vessels are smaller in diameter as compared to the cardiac vessel. But the composition is similar. Therefore, the concept of low-intensity shock wave being given to the penis was originated and experiments were done, and now it's a well-established technique. Most useful in cases of erectile dysfunction cases where Viagra or its similar medicines known as PDE5 inhibitors are ineffective for whatever reason. Then we had nothing in our armamentarium except surgery. Now with the low intensity shockwave therapy, this is another non-invasive treatment. The beauty of this treatment is that it is given over a period of time in the outpatients department. It has no side effects whatsoever. It is pain-free, and should it not work, we can still do the penile surgical techniques. What it is that it consists of a probe which is applied to the shaft of the penis. There's a generator which emits the acoustic waves, and these acoustic waves are then hit the muscles in the shaft of the penis. It's applied at 3 different places and specified number of shock waves are given. The whole procedure takes only about 20 minutes or so. As I mentioned earlier, it works by increasing the blood flow to the penis. How it does that is that it emits certain hormones which increase the blood vessels to the penis. They actually increase the blood vessels to the penis so that the blood flow is increased. That's what we want. Now, the other difference between using Viagra and its similar medicines is that they are a one-time effect. In this, if the blood vessels are increased, then the result is going to be more permanent. This machine was first used in 2010, and an Israeli company started the technique. And now there are some other companies also which produce the same type of machine. I have had this machine for over 10 years, and I can tell you that in most cases, it does produce results. Whether they are short-term or long-term is a different matter altogether. But at least in periods of crisis, like immediately after marriage, it can be used straight away to give relief to the person. There's a lot of enthusiasm about treatment of erectile dysfunction globally. And to improve the results of LISWT, another therapy can be added to it, which is hyperbaric oxygen therapy. You see, the problem with erectile dysfunction is twofold. One, that the blood vessels, at the inner lining of the blood vessels develop deposits which prevent the hormones from being released from the inner lining of the blood vessels, like cholesterol deposits in the blood vessels. Now, one way is to increase the number of blood vessels. But the other way is to increase the substance that produces dilatation of the vessels. I'm talking about nitric oxide and oxygen, good old oxygen, which is required for the penis. Indeed, oxygen is so important for the muscles of the penis that during the night time, there are micro erections occurring all through the night. The purpose of this is to increase the blood supply to the penis, and with the blood supply, oxygenated blood supply, oxygen goes to the muscles. Again, if for whatever reason the oxygen does not go to the muscles of the penis, what will we have? Disuse of the cells or damage to the cells of the muscles of the penis. Now, if we can somehow increase the oxygen supply to the penis, this will also work in improving the musculature of the penis. So one way was to increase the blood flow to the penis. The other way is to increase the end products, oxygen, nitric oxide. And this procedure can be done nowadays by hyperbaric oxygen therapy. Hyperbaric oxygen therapy is by giving high pressure oxygen to all cells of the body, including those of the penis. I have with me an expert in this field, Dr. Tarun Shani. He is the director hyperbaric oxygen therapy at Indraprastha Apollo Hospitals, and I'll request him to tell us a few things about hyperbaric oxygen therapy. Viewers, I have with me the director and head of the hyperbaric therapy department of Indraprastha Apollo Hospital, Dr. Tarun Shani, very experienced and practical. Welcome, Dr. Shani.
Thank you, Ajit. How are you doing?
Great. Dr. Tarun, will you tell our viewers what is this hyperbaric therapy about? What is a hyperbaric oxygen?
So the term hyperbaric oxygen is actually self-explanatory. Hyper is high, baric is pressure, and oxygen is oxygen. So high pressure oxygen is used by people who were initially deep sea divers and they had complications. We used to treat them with high pressure oxygen. In the last 3-4 decades, high pressure oxygen is being used in most hospitals for a large number of medical and surgical indications. The commonest indication is for delayed healing, non-healing wounds where it helps promote new blood vessels.
How do you do the hyperbaric therapy? What does the patient expect?
The patient would be treated in what we call a hyperbaric chamber or a hyperbaric room. This is an enclosed room which is sealed from both ends. It's something like being in an aircraft. When you travel on a flight, you come in, they give you a seat. We'll do the same thing. We'll assign a seat to you. The doors close. And after the doors close, we increase the pressure. Like when an aircraft takes off, you can feel that the pressure inside is changing and you feel some pressure in your ears. So it's exactly the same phenomena. You feel exactly like that. Once you've reached a particular altitude or a particular depth in hyperbaric terms, we then give you an oxygen mask to breathe. And through this oxygen, you breathe oxygen which is under pressure, 100% oxygen for approximately 60 to 90 minutes.
Right.
What this high pressure oxygen does is this induces an additional amount of oxygen to be carried in the blood. Now, this oxygen is not carried on the red blood cells or in the blood. This is carried in the plasma. So, which is the reason the plasma can actually diffuse into areas even where normal blood circulation may not go. And this additional oxygen is what is responsible for the complete healing which takes place because of hyperbaric oxygen.
Excellent. Now, this is like sitting in an aircraft, but you don't have to wear seat belts.
No, you don't have to wear seat belts. I mean, you'll have a nurse or a paramedic. Unfortunately, I can't get an air hostess to you, but you're being closely monitored from your medical treatment point of view. Like an air hostess monitors your flight and any issues there. We have a nurse or a paramedic who will monitor your treatment at any given time to ensure that you're comfortable during the process.
Wonderful. Now, do you think it has some role to play in erectile dysfunction?
See, there have been a lot of studies, and there was an article in the Nature magazine a couple of years ago, wherein it was demonstrated that hyperbaric oxygen, because of the fact that it induces angiogenesis and nitric oxide is generated. So those were the parameters on which there were a few studies saying that it does help people with erectile dysfunction. It is still a research indication, but I think there's a lot of promise in it. Unfortunately, this particular indication, people are a little shy about coming forward with it and coming forward for the treatment. But looking at the evidence, I think there is merit in combining hyperbaric oxygen, and we could look at a few patients whom we could do as a study or as an example in the initial part, but there is definitely a scientific logic to it.
I think so too, because it's working by a different mechanism altogether from what we are using.
Absolutely.
Thank you very much, Dr. Tarun Shani.
Thank you. Thank you, Ajit, for inviting me, and all the best. Thank you.
It's been a pleasure.
Thank you.
Combining the two techniques will help the patient immensely. Why? Because LISWT increases the blood flow to the penis by increasing the number of blood vessels. Whereas hyperbaric oxygen therapy gives oxygenated muscles, mops away the oxidants that are produced. And therefore, the two act by totally different mechanisms. The result of increased blood oxygen plus increased blood supply is that procedure is more than additive. Hyperbaric oxygen given to the entire body, including the penis. It's early days yet. We are doing a trial on this. I shall let you know in about 6 months' time how it works out. But the concept is interesting and should bear results. If you like my video, press the like icon. If you have any comments or suggestions to make, please do so. And yes, don't forget to press on the subscribe button.